DA, the DA is calling on Gauteng Health to urgently address problems at Rahima Moosa Hospital. It's a mother and child hospital, of course. Damning allegations and damning reports coming out about the conditions at the hospital. But the question, of course, has to be, can government do anything about this? Well, let's hear from Health and Social Security Specialist Alex van der Heever from the Wits School of Governance joining us this morning. Alex, good morning to you. I always appreciate your time. This really is a proper mess at the hospital. I mean, where do we begin to try and fix this situation?
Well, it looks like that there has been sort of a consistent long-term neglect of much of the provincial health department. And what happens is that a sort of a multifaceted set of problems build up over time. Facilities aren't properly maintained. The correct configuration of facilities, like whether or not you have ICUs and laboratory services, aren't done because nobody's basically prioritizing that. The staff are not properly qualified for their positions in administrative and leadership positions, and you don't have effective management of logistics and supplies to facilities. So you're effectively not providing your clinical staff with the kind of environment they need to be able to support patients. Plus, what's also very clear is that the Gauteng provincial government and national government have failed to address the issue of uncompensated cross-border flows. This doesn't mean you discriminate against those patients, but you need a financial solution which is part of a regional negotiation. Nothing has happened. So there's just no action on a whole host of fronts. And what you have is essentially a decaying public health infrastructure and system.
Like I said, very messy. So where, to your mind, is there a way to start getting on top of this? Because that's a litany of issues you've just wrapped off there, and quite rightly as well. Where would you begin? Where do you start this? Is it from the government side? Is it from the leadership side? Do you start from the bottom and work your way up so at least patients can get what they need while you fix the problems at the top? Or do you invert it and go from the top down? Which way would you go?
I think that the problems are quite deep. First of all, you have to replace and put in competent leadership that are not political appointments, and this should be done relatively quickly. If you don't have people who are making the key decisions, who are capable of making those decisions, then nothing is going to be corrected. And that is it's at the provincial level as well as at hospital level. The second issue is you do need to have now, because you're in a state of crisis, you're going to have people with authority, teams with authority who are able to do turnaround strategies. In terms of things like facilities that need to be refurbished and new services, that requires that the budget process and the sort of decision about deploying resources needs to be part of sort of pretty rapid decision-making process as well. And I really don't see it. Some people might argue that the money's not there. The money is there. The money is just being squandered. So part of the budget process and resource allocation process is essentially looking very carefully about how you not only spend money, but how you save it. And I'm not talking about saving in a sort of relatively crude sense. There's a lot of savings to be made with the massive waste and corruption we've seen at Tembisa, which is just the one that one's had deep insight into, where over sort of probably around about 1.2 billion rand was stolen. And that is the size of the money that's flowing out of the Gauteng Health Department. Now, you can build an entire new hospital for that kind of money. And this is potentially happening systematically across the province. And part of the concern at the leadership level, why people don't change, is because they're there to turn a blind eye to some of this. And this is very much part of the problem. So I don't know how you're going to solve the problem if one of the primary things, if you don't actually have a commitment to do so. And I don't think it's there. I think we're not seeing it at all. There's no sense that, in fact, the light bulb has gone on in this provincial government at all. They're sitting on their hands and potentially protecting the people who've been party to the collapse of the provincial health system. And unfortunately for them, they don't have the political will to actually take on the challenges that they've created essentially over a large number of years in the past.
Yeah, some reports suggesting that this has been decades, that this has been on the go, and then this is why we are where we are. Where does the buck stop, though? If it's not provincial health, then I imagine what we start doing is we start scaling up, don't we? We start going straight to the Minister of Health himself as well, Dr. Joe Patla. What would he need to do? I know whenever we talk about issues at hospitals, the last thing that needs to happen is to start firing CEOs and doctors and nurses who are incompetent at their job. But are we at a point, Alex, where maybe that is the best thing to do, to just scrap the whole thing and restart? I don't mean infrastructure-wise, I just mean those that are there. Scrap the whole thing and restart, or is that just too dangerous to do when you're dealing with people's lives?
Well, I don't think it is too dangerous at this point. I think that in many cases, the senior leadership of public hospitals are themselves destructive, and you need to put people in place that are competent. The process of doing so needs to be done with care. I do think it needs to happen. If you don't have people who are running such complex organizations with the right capabilities, you can't solve any problem from that perspective. But the problems also go several layers deep. But it starts there with the hospital CEO, and it starts with the head of department and the whole top level team. I would say that at this point in time, they all should be removed and replaced. I actually think that is one of the essential things that needs to be done at this point. However, just removing people and replacing them with people who are similar is not going to make any difference. And this is part of the problem that we've had over a number of years, is that it has become part of a party political process of appointments. So there's only a certain pool of people that will ever be drawn on to be appointed into the senior positions of the provincial administrations. And there is an understanding with that group as to how they must behave and conduct themselves in relation to issues that are of importance to the political party and key people who are in leadership there. So you can't just remove people and replace them with the same bunch, with the same attitude and the same accountability structure. It needs to be changed completely. And you mentioned the Minister of Health. I don't believe that he has any incentive to do anything different to Lesotho at the provincial level. The problem is very much a combination of political and technical considerations. And unless you're prepared to take these things on head on, you're not going to make any difference. But part of the problem is you take them on head on, you're going to face a backlash within your own party because of how deep the rot has got. And this is why nothing actually happens. This is the concern. It's more widespread than health, as I think many people are aware. So the problem is really, really deep.
It really is, and I appreciate you being able to explain it so easily to us this morning. Alex, thank you very much indeed. And on top of all of this, people's lives are now at risk while this infighting and this non-action is ongoing. Alex van der Heever, I appreciate your time. Health and Social Security Systems Specialist from the Wits School of Governance joining us this morning. It really is diabolical what's happening at Rahima Moosa Hospital. We will stay on that, of course, and bring you more as we get information and try and get some more answers as to what is going on and how do we fix the situation.